What is this term that you use, executive functioning?
Executive functioning relates to how the brain organizes itself, directs itself. Call it something like the CEO or the orchestra conductor. In other words, you have all these very talented musicians, employees, whatever, but if someone isn't coordinating them and directing them, all those talents are going to go to waste, and in fact, with an orchestra, it's going to become cacophonous. So there's a part of the brain that is in the prefrontal cortex that basically directs the brain how to go about solving a problem, how to handle a task, and we don't realize it enough, but when you think about what we have to do when someone might ask us a question, we have to wait till they finish the question. We have to wait and understand what they're really asking us. Then we've got to figure out an answer. Then we have to relay it from the nonverbal part of the brain into the verbal part to speak the answer, or in a nonverbal way, we might have to write the answer as well. So simple things will require 4, 5, 6 different steps. So it's that center that directs the brain and tells it how to go about doing it efficiently.
If a child has ADHD, how executive functioning processing related to that?
That's basically the problem with ADHD. The part of the brain that directs its activities is immature. It's developmentally delayed, and they say that on average, the average ADHD kid's center is about 3 years delayed. So if you could imagine a 7-year-old in second grade who has the IQ and intelligence clearly of a second grader, yet his self-control, his ability to listen, function, decide what steps to take in a mental operation are more like a 4-year-old. We're asking a lot of that child to try to function, so he's trying to answer questions, and I like to say with one hand tied behind his back.